Disclaimer. This video content is AI generated as educational purposes only and is not a substitute for professional medical advice, diagnosis or treatment. Your health concerns may be unique. Always consult your physician or a qualified healthcare provider for personalized guidance.
You know, when we talk about cancer, we almost always picture the first tumor, where it all started. But what happens when that cancer decides to travel? One of the toughest, most significant challenges in modern medicine is when it reaches the brain. Today, we're diving deep into the fight against these secondary tumors, which we call brain metastases. And this isn't some rare complication. Just look at this number. A staggering 20 to 40% of all cancer patients will end up developing brain metastases. Let that sink in. That's up to 2 out of every 5 patients facing this incredible secondary battle. It's a way more common problem than many people realize. So what are we really talking about here? It's super important to get this right. Brain metastases are not a type of brain cancer. They're actually cells from a cancer that started somewhere else, like in the lung, breast, or even the skin, that have broken off, traveled, and set up new tumors in the brain. And get this, they are the single most common kind of brain tumor found in adults. Now, this is where it gets really interesting. While a lot of different cancers can spread to the brain, just look at how these 3 dominate the chart. You've got lung cancer, breast cancer, and melanoma. They account for the huge majority of cases. Figuring out this origin story is really step 1 in planning the fight. Okay, so how do doctors even find this unwelcome visitor in the first place? I mean, before you can fight an enemy, you have to be able to see it, right? Well, that's where the diagnostic process comes in, and it relies on some seriously sophisticated imaging tech. The 2 main tools in the shed are CT scans and MRIs. The easiest way to think about it is like this. A CT scan is kind of like a basic roadmap. It's quick and it gives you the general lay of the land. But an MRI is like a high-resolution satellite image. It uses these powerful magnets to paint an incredibly detailed picture of the brain's soft tissue, which is exactly what you need to spot these tumors. And this right here just perfectly illustrates why the MRI is considered the absolute gold standard. The level of detail, the contrast you get in brain tissue, it's just unmatched. And that clarity isn't just about finding the tumors, it's absolutely essential for mapping out their exact size, number, and location. That information dictates the entire treatment plan. But hey, sometimes a static picture just isn't enough. So there are these advanced techniques that give us functional data, telling us what the tumor is doing. Perfusion-weighted imaging, or PWI, it measures blood flow to see if an area is abnormally active. Magnetic resonance spectroscopy, or MRS, actually analyzes the chemical makeup to confirm, hey, is this actually a tumor? And PET scans look at metabolic activity. These tools let doctors get answers to very, very specific questions about a tumor's biology. All right, so the diagnosis is confirmed. What's next? Well, the modern approach to treating brain metastases isn't a one-size-fits-all thing. It's a multi-front attack, and it's tailored specifically to the patient, to the original cancer, and to the tumors themselves. The treatment toolkit is really built on 3 foundational pillars. First up, you have surgical resection. That's physically going in and removing the tumor when it's possible. Second, there's radiation therapy, which uses focused energy to destroy the cancer cells. And third, we have systemic therapy. These are the drugs that travel through the entire body to attack the cancer wherever it might be. You know, the evolution of radiation therapy is a perfect story of how much treatment has advanced. The old method, whole brain radiation, was kind of like a floodlight. It blasted everything, which, yeah, it treated the cancer, but it often caused some pretty serious long-term cognitive damage. The modern approach, though, it's called stereotactic radiosurgery, or SRS. And it's not a floodlight, it's a laser pointer. It delivers this powerful, precise dose of radiation only to the tumor, sparing the healthy brain tissue around it. It's all about preserving the patient's quality of life. Now, for decades, that third pillar, drug therapy, faced this massive wall. It's called the blood-brain barrier. Think of it as the brain's own natural, super selective security system. And it was so good at its job that it basically created a sanctuary site for cancer, blocking most chemotherapy drugs from ever getting in to do their work. But this is where the story takes a huge, dramatic turn. As this quote says, the game has been completely changed. We now have a new generation of drugs that are designed to be CNS penetrant. What that means is they can actually get past that security system. They are literally designed to cross the blood-brain barrier and take the fight directly to the tumors inside the brain. It's a revolution. So here's how this incredible targeted therapy works. First, Doctors find a specific genetic weak spot, a mutation in the cancer. Then, they pick a drug that's built to attack that exact mutation. Often, these are tiny little things called tyrosine kinase inhibitors, or TKIs. They're small enough to sneak across the blood-brain barrier, letting them hunt down and attack the tumors right at their source. It's an amazing systemic solution to what used to be a very localized problem. And all of this brings us to a really crucial point. Because patients are living longer and these treatments are just getting better and better, the whole focus has shifted. It's not just about fighting the disease anymore, it's about preserving the person. This has completely changed the goals of care. It's not just about short-term survival. The focus now is on long-term control of the disease inside the brain, while fiercely protecting what makes us who we are, our memories, our personality, our ability to think. It's all about maximizing a person's quality of life. Now, whenever we talk about quality of life, the term palliative care comes up, but honestly, it's so often misunderstood. So, what is it, really? Palliative care is a specialized field of medicine that is all about providing relief. Relief from symptoms, relief from pain, and relief from the stress of a serious illness. Now, the most important thing to take away here is that this is not the same as hospice. Not at all. It can, and it should, be given right alongside curative treatments like surgery or radiation. Its only goal is to improve the quality of life for both the patient and their family. The progress we've made has just been incredible, but the fight is definitely not over. So let's take a look at what's on the horizon and some of the big challenges that researchers are tackling right this second. Okay, here's one of the biggest dilemmas doctors face after treatment. On a standard MRI, if something new shows up, it could be the tumor coming back, or it could be something called radiation necrosis, which is basically just scar tissue from the treatment itself. The crazy part? They can look identical. This is where those advanced imaging techniques we talked about earlier become absolutely critical to making the right call. And that dilemma? It's just one of many questions driving the research forward. Scientists are trying to figure out the best timing for combining radiation and immunotherapy. They're asking, should we measure disease by tumor volume instead of just counting the tumors? They're working on how to manage side effects like necrosis. And they're exploring whether a liquid biopsy from spinal fluid could one day replace the need for invasive brain biopsies. Which leaves us with one final and really hopeful question to think about. We've gotten so much better at finding and fighting these tumors once they show up. But what if the next great breakthrough isn't about fighting them at all? With a deeper understanding of how these cells travel and thrive, could we one day stop them from ever reaching the brain in the first place?